So Glasdegib is an oral hedgehog inhibitor. This was a drug that was evaluated in a randomized study in older patients with AML who were unfit for intensive chemotherapy. It was a randomized study comparing low-dose cytarabine versus low-dose cytarabine plus Glasdegib. The combination with Glasdegib did increase the response rate and increase survival, and that led to an FDA approval for Glasdegib for older adults who are unfit for intensive chemotherapy with newly diagnosed AML. The challenge with Glasdegib is that unfortunately this study was done right before we had very robust data from the combination of Venetoclax, either low-dose cytarabine with Venetoclax, or more commonly used Azacitidine plus Venetoclax. That was a much better comparison done, for example, in the VIALE-A study where Azacitidine and Venetoclax was compared to Azacitidine alone. We think of Azacitidine as a better comparator than, for example, low-dose cytarabine. And ultimately, the outcomes that we've seen with Azacitidine plus Venetoclax as far as response rates and survival is better than was seen in the study of Glasdegib. So even though there is an FDA approval for Glasdegib, we rarely use this drug. I know that many AML experts, many of them have either never used it or very rarely use it. And I think it's just because of the competition in the space where now we have a much better drug in Venetoclax, which yielded better outcomes in the study and also was a more convincing study because of the better comparator in Azacitidine compared to the low-dose cytarabine in the Glasdegib study.